There's some contrast in the back there, but that's okay. You look mysterious. You know, you look.
Sorry about that. I know I have the light here. Let me try.
What if you could you turn like a different? Would that work?
Oh yeah, if I can angle it this way, maybe that works better. That's fine.
Yeah. That's a lot better.
Great.
Constantine, how are we doing today, man?
Doing well. How are you, Brendan?
Good, good. I'm happy we got to meet. This is our part 3.
Wow. I'm honored.
We got to get more. We got to keep it going. I want every year we got to be sitting down, having a good chat. How's your day going, though? I know we're fitting in a tight schedule here.
It's been going well. Busy day. Working on 3 healthcare employment agreements at the same time. So that's fun. And just moving with the litigation and everything else. How's your day?
Good, good. Home from work now. Just it was a medium busy day, so I mean I can't complain. Medium busy is not too busy. But the three healthcare compared to what other areas do you do law in actually?
Within healthcare or in
Because
general?
you said you're working on 3 right now within healthcare.
It's employment agreements. 1 other oral surgeon and 2 physicians. We're working on their employment agreements. One of the physicians is straight out of a residency. One has been practicing for 10 years and is just in the midst of contract negotiations. And the oral surgeon is also straight out of residency.
Did the oral surgeon did they hear about you through the podcast by any chance?
I don't know. I will ask. I wouldn't be surprised. I never ask the right questions with these things. My wife always asks, she's like, did you ask this? I'm like, no. She's like, why did you ask that? That's how we feel about your question right now. It's a great question. I should have thought of it. Should have asked, but I did not. And I will ask. So I'll get back to you on that.
Yeah, and well, it's also we gotta that's a good question. I was gonna say because that person would be good to obviously client confidentiality, but to get their experiences at the end of it, kind of what they went through with the modifications of their contract, that would be super beneficial to listeners, and it would always obviously promote your services through it. So that's something to consider for the future. Sure. But obviously client confidentiality. Yeah, just hey, let them know.
It's her confidentiality, her privilege to waive, not mine. And if she's okay with it, then yeah, absolutely.
Good. And so yeah, since why don't we kick this off? There are a couple of questions I want to ask as far as any like for example to start, any recent updates with law as far as employment and in the healthcare space that have kind of raised eyebrows. If you're anything off the top of the head that comes up, you know what I mean?
I'm finding more litigation now on non-competes generally, enforcing agreements. I feel like the first one we might have predicted the DSO explosion, and that is something that I've read about plenty in the past months, but now I'm actually dealing with on the ground. Practices, mom and pop shops, small offices selling to DSOs, MSOs, and other fields within healthcare. That explosion is really happening, and I don't know. It's almost like the doctors and the small practices when Northwell exploded and just swallowed up all these little practices. I don't know how many small dental offices or oral surgery offices will remain after this explosion.
All right. Well, I guess we'll wrap up this talk. Man, that's a sad thing to know. Really? You think so? It's really looking that bad?
Don't shoot the messenger. It looks like it's a pattern. And I discussed it with one of the associates here. We're going through one of our litigations and noticed that going back a few years, I didn't see this many. I didn't think there were this many going on. And now the pattern seems to be that we're encountering more of these directly, that we are working on, not just reading about them in a law journal or some other news reporting agency, but actually handling these matters.
Oh man. All right. I mean, that's great. That's great for you guys. That's more work, right?
Yeah, but there's more risks too. We get the risk on both sides when we represent the practices or when we represent the providers directly, the physicians, oral surgeons. There's a risk involved in litigation. We try to offset that by coming to terms and trying to negotiate. And sometimes you have reasonable minds on both sides and sometimes you don't. So the risk is not something you can avoid in every situation.
Interesting. Yeah. Also for listeners, just really quick. So So Konstantine's an attorney, right? And he works very commonly in the healthcare spaces. This is why I wanted him on the podcast. Now for part 3, like I mentioned earlier, but Konstantine helped me with my contract, with my current position at All County Oral Surgery. Just to, smoothing out the whole contract and everything, not meaning good or bad, just neutral, just staying neutral as far as that goes. You want to make sure that you have a legitimate attorney in the space that you work in, right? You don't want someone who's dealing with I don't know, like someone who's dealing with mechanics all the time to come and look over your contract as a dentist, an oral surgeon, a physician. You want someone who's in your space, right? Someone has years of experience, years of tried and true errors and fixes, and someone who is very knowledgeable and has the experience in your area. That's very important. So that's Konstantine. Okay, so for everyone listening, and we're going to talk about a bunch of things in this time that we have right now. Why don't we kick that off? Any updates on that restrictive covenant? I know our last chat, this was a little over a year ago, and we were talking about how in that year, like 1 to 2 years ago, there was a bunch of changes where it's like, oh, can it actually be upheld in New York State? Will it be upheld? Is it in favor of the administration of the corporations? Is it in favor of the employees? Maybe we could just kind of bring that back to life a little bit. And what's the current standing of that, Konstantine?
Yeah, well, thanks for that great introduction. I appreciate it. I agree. Obviously, it's a little selfish of me to agree, but you do want someone familiar with the things you'd find in a contract, especially in the healthcare space. You want someone that's familiar with the lingo, is able to talk to whoever it is on the other side, both for the practice and for the individual employee. You want to have that meeting of minds where we can understand each other and sort of be able to deal with any issues that come up directly. As far as what's happening with the law, nothing has happened. That bill that the state Senate passed a couple of years ago, Governor Hochul vetoed it. And to my knowledge, there's been nothing of the sort that would blanket ban any sort of restrictive covenants. The federal blanket ban fell apart. And so right now the state is business as usual as far as how these things are running.
So, and just for listeners, a restrictive covenant is, say you work at one practice and you're looking to leave that practice or practices. A restrictive covenant is the radius around that practice. You're not allowed to work within that radius. Okay, so that is upheld. So you could be sued if you try and work within that radius within a certain given amount of time. It's usually a year or 2 years, would you say?
It really depends, but that's just one aspect of the restrictive covenant, is preventing the former employee from competing with the former practice. And they can do it by scope, radius. It depends on where you're located, how far you're having to go to find any sort of other service provider within the area. So if we're in Manhattan and I tell you that you can't operate within 2 miles, it basically puts you out of Manhattan. And so a court might typically say, well, you know what, in Manhattan, that's too far. Maybe 1 mile or half a mile. Maybe further out east, when you get into Suffolk County, 2 miles might not seem like a lot because you don't typically have too many major towns or cities in that range. So in that event, yeah, you could probably pick up and move somewhere else within the county and still have, reasonable expectation that you can earn a living. Another thing you can restrict is communicating or contacting, trying to solicit former patients, former coworkers. These would all fall under any restrictive covenant. So anything you're trying to prevent the person from doing after the relationship ends with the practice into a new business, whatever that looks like, whether the doctor dentist is going out to open their own practice or whether they're joining another practice. The original practice is trying to protect legitimate business interest in creating these restrictions.
Right. So it also goes for your coworkers there, as well as patients, patient population, clients, customers, etc. Now, that's a good point. 2 miles would cover everything in Manhattan. From where I remember this is a year ago, 2 years ago, when I was looking for jobs while I was in residency, I remember it being usually like within blocks. Like you can't work above 50th Street or whatever. Would you agree in Manhattan it's generally like that? So it's a pretty tight, narrow area?
Yes, it makes sense. It definitely makes sense to do it in the blocks setting because we have Manhattan as a real grid, top to bottom, where you could just basically anything west of 6th Avenue or whatever above 50-something Street. That would be more reasonable. A court looking at it would say, you know what, they took the time to think this through. It's not just a blanket ban.
Yeah.
Those kind of things would avoid a court just taking what the legal profession deems a blue pencil and just altering a line and saying no, as opposed to saying 2 miles, we're going to say 15 blocks or whatever from this location. Something that shows a little thought, a more nuanced approach to the restrictive range is likely to be upheld by court.
Right. Right. And then on Long Island, like you were saying, 2 miles isn't that much. My restrictive covenant's 5 miles around the practice that I work in. And what's the word, which I think is very reasonable. I think it makes sense. Do you, off the top of your head, do you know? Because I've seen restrictive covenants up to 30 miles. That was the biggest one I've seen. You can't have 30 miles on Long Island. That's going to encompass a whole county, more or less. What's the worst restrictive covenant you've seen?
I've seen 20 miles, but
On Long Island?
no, I'm trying to remember if it was Long Island. It might have been Orange County. And I've seen something a little further upstate in that range, something that sounds egregious to people from the city. But I've also seen courts uphold it, where, again, you have other facilities within a reasonable distance. How much of a commute are you dealing with? And I just don't want to be that case when I represent the provider, when I represent the individual employee, to fall into that situation where the court says, yeah, you know what? You could drive that extra half hour, 45 minutes, 1 hour to get outside of that zone. You don't need to pick up and move. And it's tough when you leave that into a judge's hands. The judge might not be familiar with the practice. There might not be a lot of practices in that area or a lot of case law coming through in that department. And it's a little bit of a gamble. So nothing against rural practices, nothing against the rest of the beautiful state of New York, but again, it's something that we're hesitant to dive into and challenge, because a court might say, you know what, as of today, 25 miles is not unreasonable for this reason, and sort of look at the background, look at the additional commuting time or whatever else is involved to determine however many other facilities exist within that range and whether the patients themselves are negatively affected if one doc has to pick up and move out of county or out of the area.
Yeah, yeah. And so there was actually a friend of mine who's in residency looking for contracts right now. And I did give them your information, by the way. I don't know if he reached out, but regardless, he was actually asking me about two things on his contract. One of them was about that restrictive covenant, how enforceable it is. I think it was like 10. And then he was saying, like, what if I left and I'm working at a practice with an 8? I want to know what your thoughts on that. And then the second question, which I could repeat later, was he was also wondering if it's a 2-year contract, but he leaves after 1 year. Those two things. I'm curious what your thoughts are on there.
Well, I have to see the second, or like actually see the contract, because a contract for a term, there might be other repercussions. You might have other penalties. You have to pay forward some amount of bonus payments, or pay forward your payment for malpractice insurance and other costs that the practice has to carry. As far as the first one, again, it's specific to the actual agreement. The only thing now that I'm seeing more, even with taking intakes, and I don't believe I spoke to your friend, but I had a few people that I spoke to that I know then used AI to assist them with their negotiations, and it's scary. I mean, it's a whole. As far as the last time we spoke and today, AI is so pervasive in every aspect of any business. But as far as the law, the AI, number one, doesn't have to deal with professional rules of conduct that attorneys have to deal with. Number two, it's not a legal dictionary. It's not up to the latest and greatest in the law. You can ask it to act like an attorney who's been practicing for 20 years in the healthcare space and and what changes it would make. But I had one doctor send me back an engagement letter asking this firm, to agree to a restrictive covenant in favor of this doctor. And we're not allowed, if we sign this deal, we would not be allowed to represent physicians or practices ever again, just for this one doc. And I know from my heart that came from AI. It's like, here, read this engagement letter from an attorney and tell me what changes I need to make. And it's like, well, you should tell the attorney to not represent other doctors in the space lest they compete with you and so on and so forth. It's ridiculous. Ridiculous. And yeah, I had a good laugh too, but I don't think that if this person is serious and is using this device to actually negotiate, I don't think it's going to get the optimal outcome. And I'm
Mm.
actually concerned for people, and it's a growing number of people that are using AI in trying to make all decisions, second guessing. Maybe they second guess. A patient comes in and you give a diagnosis, and they're like, "Well, what about this, and this?" And they're ridiculous. They wouldn't apply. You've gone through your residency. You've gone through all this training. You've gone through it in the field now, and it makes no sense. And here this person is with absolutely no training and no understanding of the words they're reading to
Yeah.
you, and they're treating this like it's a legitimate second opinion because they feel like there's this like, it's almost like this doctor patient relationship because they're typing in this little terminal. It's just the two of them, even though it's, scouring words from the internet or whatever. But they
Yeah.
feel like there's this like this priest relationship of confession. Like, let me just get this. Oh, I trust this now because it came directly to me. So I'm wondering, is that even something that you're dealing with as well?
Yeah, yeah, in a way, yeah. Patients are using AI. The biggest thing, the most common thing I think is TikTok. Everyone comes in saying, "Yeah, I searched this on TikTok and I was looking up dry sockets and this and that." And it's remarkable. I try to put out as much content as possible to give my professional and personal opinions on things like that, but there's so much content out there that there's like there's buzzwords, and you find other practitioners that they create these buzzwords in order to instill fear in patients. And that's another thing I'm sure you're seeing on your end. It's like there's you trying to use your knowledge. Some people use their knowledge against someone, instills fear, and now that fear overcomes a patient, and they're like, oh, no, I definitely want to, I like the cavitations I'm worried about with these wisdom teeth, yada yada. And I'm like, your body heals, it fills in. But because of this cavitation surgery that other dentists are pushing, it instills a fear. It's like, oh yeah, I didn't think about that. It's a cavity in the body. Bacteria is going to go in there, and it could cause problems later on. No, it's like this kind of cavitation fills in normally with bone within 6 months tops. Yeah. The fear factor is a real thing, and I'm sure you see it in law a lot.
It's scary. I think we need to go back to, and I love when you put the trivia up there and you're like, here are the facts. Like, what's the diagnosis? And I look at that, and obviously I have no idea. You can give me only two of the four selections, and I wouldn't be able to get it for you. And that sort of leaves me reasonably to say, okay, well, I'm going to rely on Dr. Gallagher. I'm going to rely on his
Mm.
diagnosis and his knowledge and his competency generally, and just say, okay, this is what he does. This is what he's trained to do. Almost like the HBO show The Pit. I
Yeah,
don't know if you watch that show.
I've seen some episodes. Yeah.
So like there's that understanding with the entire team that everyone knows their job, right? They're working together on something. You don't have to worry as the patient or even the person watching the show. You can trust that this team is competent.
Mhm.
So put that portion of it to risk. It's not like Dr. House where you're trying to think of what you can relax, you can enjoy it for what it is. Yes, it's stressful on them, and that's kind of what's keeping it going. Is this like nonstop stress in the emergency department? But for the rest of the actual competence of the issues and the doctors knowing what they need to do, you can trust and put your faith in them. And that's sort of what we need to give back to people to understand and appreciate and listen to professionals and not sort of take it upon themselves to use ChatGPT and any number of TikTok scares to sort of
Yeah.
make their own way in a profession that they're not trained for and don't know anything about.
Oh, seriously. Yeah. I don't know if we're going back though. It's going to be an interesting, it's going to be an equation going forward. It's going to be a dynamic thing, not one thing at a time. But no, yeah, the patient trust. I'm sure you're seeing like the patient and client trust is it's changing. It's definitely changing. And I think the area is different too. I wonder. Yeah, I don't know. I don't know where we'll go. So with contracts again, let me see. There was another question I had for you as far as that goes. So we hit restrictive covenant. We hit the timeline, and like you said, it depends on what the specific structure of the contract would be. Here's another thing that I think people should think about. What's a timeline as far as like? Because I remember our contract, like it took weeks to months to finally like get signatures and be done with, right? What would you say is like an average timeline? Because I think they think that they're just going to send it over to you, and then you guys like make some edits and revisions, and it's done. But it doesn't work that way.
No, it doesn't. It really depends on what or how much the parties themselves flushed out beforehand, which is easier when you don't have a DSO or an MSO involved. It's like doctor to doctor. I sat with the practice leader, the principal, shareholder, or what have you, and we discussed and we dealt with all of these issues. So, assuming both attorneys are on the same page, I receive a contract from the practice counsel, and it looks exactly like what I expected based on my conversation with you. And so that in that situation, we can resolve and sign within a few weeks. Then you have the practice attorney didn't speak with counsel, or the doctor's attorney didn't have any conversation with counsel. And so this attorney appears last minute, doesn't really know what to look for, is making like these like form changes just to impress upon the client that he or she, deserves the fee that they seek to participate and negotiate in the contract. It runs both ways too. Sometimes there are deadlines. Sometimes the practice is trying to replace someone on the fly, and this is a hole they need to plug quickly. And in that situation, they might move the ball faster, and you'll see those emails come in from the practice attorney. If I'm that person, I'm like, hey, following up on this email from yesterday, do you have any changes? Do you have any responses? So, I mean, it runs the gamut. We can see a couple of weeks, we can see a couple of months, but it's based on the needs of the parties.
That's very fair, and that makes a lot of sense. Another thing I wanted to touch on before you head on out, I want to go through some red flags for contracts, for people, maybe even other attorneys that they should look out for in contracts that they're reviewing, but especially for dentists and oral surgeons looking for it. I remember something that I saw, I forget if someone showed it to me or whatnot, where a contract had mentioned no practicing, for an oral surgeon, no practicing dentistry at large. That, I think, I forget who said, but it's an obvious red flag. If you're an oral surgeon and in your contract saying no practicing dentistry, that's going to put you out of work potentially for 1 or 2 years, whatever it was. That's definitely a red flag. And then hopefully they address it in that contract. But what are some other red flags, maybe 2 or 3, if you can think of any?
So last month, we resolved a contract on behalf of a small practice. And then the attorney for the doctor turned around and went to renegotiate new terms in things that we already went back and forth on, and there were no changes previously. So it just felt like they wanted to put everything at issue again. And I know the principals of that practice expressed frustration with that deal. And I myself was frustrated because it felt like we resolved this, right? Like you had this contract for however many weeks. This is the third or fourth back and forth. You didn't see any issue with it then. You've given me, it's not like your client saw it and then all of a sudden the client had the issue. And now are we really back to square one at this point? Like when do you see a resolution? When do you see us actually moving forward and signing up your client? So that's a red flag. Any sort of inability or unwillingness to move off of obvious terms, like say, I want 2 miles in Manhattan, and a pushback on something like that, or a pushback on something where the law is settled. Like that seminal case that said that the oral surgeon who the practice hired only to perform oral surgery and not general dentistry could not, as a result of signing this contract, practice general dentistry, and that was upheld by the appellate division. I push back on that. I cite to the case. I tell the practice attorney, hey, this is bad law. Like you can't make this request. And then for them to poo-poo it or just stick to their guns, I mean, that's not a good look. That's a red flag too.
Yeah, not great. Yeah, those are a lot of red flags there. Any other things in a contract specifically, like keep your eyes out for? Because that's obviously like kind of on the back end for attorneys. That's very good. Poo-pooing things and then going back to square one. What about if you have any idea of what's a normal and appropriate restrictive covenant for Manhattan versus Long Island versus New Jersey? Because I know you know New Jersey decently well, right? If you have any thoughts, I don't know, maybe Connecticut versus upstate, where you got it's huge up there.
Yeah, it's a good question. What we typically do is we'll drop a pin on a map and draw that circle. If that circle basically keeps you from an entire city or a few towns, or like the range basically keeps you outside of areas that are otherwise desirable and it's an expansive area, whether that's 35 blocks in Manhattan or 3.5 miles in, I don't know, eastern Nassau County, that's a red flag. We'll take a look, and it's dependent upon the area and what's nearby. So even in Connecticut, when we say, okay, we can't be near Danbury, and this also applies to Stamford, and You're basically like, where does that leave me as a result? So the clients, they know what practices are in the area. We could also search with them and just show that there's 5 or 6 practices in that area, or maybe
Yeah.
there's only one practice. Like, could you work here? And what if they don't need you? And what about any other number of situations where you're basically excluded from working to the place you had to move to in order to take this new job?
Mm.
It's tough. There's a lot to be discussed, and when you're representing the individual employee in this situation, dealing with the practice, you have to tell them and just give them the bad news. Like, this is where we are. If you sign this contract, be mindful of the fact that your restriction basically is 25 miles, or is 5 miles, or is 2 years, or a year and a half. And we pushed for more. They shot down whatever suggestion. We pushed for this compromise on this issue. They wouldn't have it. And this is what it is. So if you sign it now, you're acknowledging that this is what you have to deal with going forward.
Mm. Is it common for practices to include the restricted covenant among, say it's a DSO, say it's a corporation that has 10 practices? Is it common that they include that restricted covenant of all the practices? I would imagine so.
They try. Yeah, they do try that. The idea is it has to protect a legitimate business interest. So the
Mm.
business interest, obviously, to protect as many locations as possible, but theoretically, does this doctor have the ability to inflict any sort of economic harm to those other practices? Well, if they're not seeing patients, right, from that are patients of those other practices, they're not taking employees that are employees of those other practices. They never interacted with those people. I don't see how, as a practice, you can make that argument.
I think it's fair. So this is some of the talk on the back end that a lot of us, the oral surgeon or the dentist or the physician, doesn't see. Kind of argument in order to protect your client. This is very important. Yeah, yeah, that's a great argument that you have there too.
Thank you. And it's something we discuss. I'll pick up the phone and call the attorney on the other side and be like, hey, like, what you're asking might sound reasonable to you, but in reality, the practical effect of it is this. And
Yeah.
I know your job is to do what's best for the practice or best for your client or whatever individually, but reason with me here and try and give me the argument. Maybe we're at an advantage because I have litigation experience, but show me how you'll be able to say to a court that you're protecting legitimate business interests,
Yeah.
because we don't have this overlap of clients or of coworkers and the like. So that's sometimes those discussions lead to something and sometimes they don't. And if they don't, it's a red flag.
What happens if? How much time we have? By the way, you
We're
said
good.
you.
I'm good. I'm good. I just pushed a few things forward, so we're good.
Okay. Okay. Cool. Cool. Because I want to be very respectful of your time. I mean,
I
you know,
appreciate it.
as you are.
I want to have as much time with you as possible. I would love to have you down here in person if you can get out
Oh,
to the city anytime soon.
that would be nice. Maybe this summer. This summer is looking good. We get a little more hours of the day, with the
Awesome.
sunlight. That would be great, man.
Yeah, I'd
Yeah.
love
Catch
that.
up
Would be
in
great.
person. Another question I have is, what's so for the restricted covenant? I know a lot of places have one. A lot of them have 2 years, the 24-month afterwards. Which one is more common that you see, and which one? How do you get it down to one or none?
I feel like I'm seeing 24 months or 2 years off the bat, and then we'll counter with 1 year, and we'll end up at 18 months. Something like that, where when it's this, or the practice is steadfast on we've never given anyone less than 2 years. They've also obviously never litigated the issue, and we don't want to litigate the issue on behalf of the doctors. We're hoping that we can split the baby on some of these issues where it's reasonable, and just pushing back in a like an inoffensive way. Give us something. Like, we're not asking for zero. We understand there's legitimate business interest here. We're
Yeah.
also not. We don't think 2 years is fair. A lot changes in 2 years.
True. Yeah. Yeah. Do you find that? Is there a difference? Say you are talking with the attorney of one of these practices. Is there a difference in behavior and attitude? If it's a big corporation, say it's a DSO, they have all the money in the world, right, or the PE backing versus a smaller practice. Do you notice is one? Because sometimes I hear certain things with the smaller practices are even worse. Has that been your experience?
It can be. It's really about how rational the players are behind the practice and how much they actually think of succession planning. Weirdly enough, the small practice, this solo doc, built this practice, now expanded it, or had expanded it over the course of a period of time, and this individual never thought of succession planning. So it's impossible to think of retirement or something as terrible as death or anything like that. And they might make promises about succession to a number of doctors coming on and then not put that in an agreement, not actually consummate it. And they might be harder to deal with. Although generally speaking, I feel like that mom and pop mentality of like a small local store more likely than not translates into your small practice. And so there's a little bit more goodwill available, if that makes sense, than your DSO, where things might be more acrimonious, even arguing that 24 months to 12 months. You
Yeah.
might get an attorney who feels like that's a slight. Like, no, the DSO gets what it wants and that's it. Like, well, we're willing to negotiate these issues, but anything in the restrictive covenant section is not up for debate.
That's interesting. I guess more or less, I mean, it makes sense. Yeah. The succession plan is, do you see, you don't see a lot of people, especially in the mom and pop shots, to have like the succession plan, but DSOs, they don't have anything, right? Because you're not getting any equity. Like, well, you're getting equity, but you're not getting real.
Right. So they don't need to worry about that. It's that individual practice started by Dr. Smith. He's been practicing for 20 something years and he's on an age now and he's not as sharp as he was and his hands tremble a little more. And, he's just never thought about what happens to the practice when I'm not running it. And some people get greedy. They don't want to offer any interest and they're not able to run the business as effectively as they used to. So there's a bit of a trade-off there, but yeah, it happens.
Here's another one for you. Say someone's working at a practice, right? Contract signed, everything's been, and then they're several months in, and then there's something coming up with their contract where they're being asked to do something in their practice that goes against the contract, or there's something there they're starting to do, they're being asked to do. It's like just all the colleagues do, all the whatever, and it's outside their contract. What happens after that?
Well, that's a good question because typically what we see in that situation is where the contract says you're going to work at this location only. And then they're like, hey, you know how the first 2 years you were at this location? Well, we need you more at that location. So even though it's not in your contract and you have the right to refuse and whatever, they don't present it that way, obviously. But the language of the agreement is clear that you can't work anywhere else unless both sides agree. They kind of coax the doctor into agreeing to work at another location. And maybe that somehow triggers the non-compete too. So now you do have two offices you're dealing with the non-compete because the way the non-compete's written, if you spend more than X amount of time per week at an office, that will be a base for the purpose of determining geographic scope and time duration of a non-compete. And so a lot of docs, when they see that, they sort of go with the flow, like, I've been working at this practice. They don't reach out to us and say, hey, remember when you did that contract for me 3 years ago? I need your help again. I don't know what to do with this. And it's something that we can negotiate. If the language is the way I presented hypothetically, and it says it has to be with your mutual agreement, and then they get that, the practice gets that unpleasant call from an attorney, or their attorney gets that call saying, hey, what are you going to do for my guy? How are you going to make this worth this person's while? Because it's only by mutual agreement. So maybe we agree that we're not going to include this office in the non-compete because I'm doing you a favor by going.
I see. So, okay.
Or maybe it's more money. There's a bonus, or salary goes up, or a number of things because it's not something that's required per se in the contract. Doesn't mean we can't negotiate it, but we both have to agree.
Of course. Yeah. That's very interesting. Yeah. So you would recommend in contracts to kind of define those boundaries, define the offices that you're working in, because it can be a disadvantage to the employee that has to move around. And then so then you'd have to contact the employee, whoever would have to contact their attorney when that stuff is happening.
I recommend it. I mean, just a lot of practices are more comfortable doing it. Our practice clients will happily call us for any number of issues, even ones that are not important, and we're happy to take those calls. But I feel like when it's the individual docs and they have an issue and it's post signing of contract and probably at least 6 months after, they don't think like, let me pick up the phone, let me call the attorney I worked with, let me call any number of attorneys just to get an idea, because I have a gut instinct that I should only have to work in this office. And I kind of remember that was something we negotiated specifically so that I wouldn't be bounced around to the 25 offices, this DSO operates.
Right. That's good to know. That's good for listeners to know. Oh, another thing now I'm trying to think of things that like, right. Well, I'm thinking in terms of oral surgery residents that are graduating residency soon, but anyone, any dentist, any resident that's about to, any oral surgeon that's about to graduate residency, in addition to the term sheet, because we didn't mention that on this episode yet, what would be two or three other things that residents should be thinking about? Or, they're about to start the practice, they're stuck in residency, they're very busy. What are two or three key points in addition to asking for a term sheet, if you go into that too, that they should be talking about?
Having a conversation post term sheet with the principal, with the decision maker, to maybe discuss other points, and in that way they can give us ammunition in addition to term sheet of other things discussed, and I can present that to the attorney for the practice, and they'll go back and have a conversation. And typically what I find is, the things that they discuss, those are the things that we'll get the changes on. And then sometimes, in that list of 10 items, we'll have 3 or 4 things I didn't discuss it, but I wish I had. And this is what the ask is. And usually we don't get that because there was never any point in time where, the parties came to a meeting of minds over it. And to the practice, and from the perspective of the practice, that feels like a new term. It feels like you're trying to reopen negotiations there. And a lot of time that's not what it is. It's just something that doesn't appear in the employment agreement, and we want to know where we stand with that. So even if you put in language kind of knocking that out, at least we do know where we stand.
And so for the term sheet is kind of a compiled list of things like your compensation, what the restrictive covenant is, what days you'll be working, where you'll be working, the bonus structure, things like that. Anything else that might be important to have on a term sheet?
You want to know benefits, how the vacation policy works, the malpractice insurance, how they work with that. Sometimes they talk about basically early termination, even if either side has a right to give notice and do it. The walk away, what it looks like, whether the practice is going to claim some sort of liquidated damages from the doctor for walking away from the practice within a period of time. That might be repayment of malpractice premiums, and it might be a number of things. So it's just as many topics as you can discuss, even if they're not included in the original term sheet, because usually that's something the practice gives and prepares, and it's usually the things that the practice is most concerned about, and the rest, the restrictive covenant might just appear, or other terms for the restrictive covenant might just come in there, not having arrived from the term sheet, and it's just, this is our form employment agreement. We're putting that in there. So if you can discuss as many of these topics as are important with you, and definitely speak to people who are in the field already to get an idea of what issues they had in their first contract, and that's wisdom, right, from experience. You can't beat that.
Yeah, that's great points. They're probably not going to include the restrictive covenant in the term sheet because they want all the green flags in the term sheet to get you kind of like, it's like hitting the gas pedal a little bit, and then maybe you'll overlook the red flags in the actual contract. Like, oh yeah, everything looked good on the term sheet. It's the exact same thing. It's exactly what we gave you before. It's just got some, it's got the attorney lingo in there, and that's the restrictive covenant there. That's a great point.
A lot of these guys coming out of a residency, they see the key things, the meat and potatoes are there. This is the salary agreed. This is a bonus structure, and that's all I need. Here we go. Or here we go, ChatGPT. Give me any other ideas you have.
Here's ChatGPT, throw it into Claude. Another couple things is your board's exam covered, travel expenses, relocation fees. Some people will throw you signing bonus. Signing bonus is often in that term sheet, right? Oh, we'll give you an extra $50,000, and then. Right. That $50,000 you don't get until you've completed like 1 year or 6 years at the practice. Yeah. There's always kicker. They oh yeah, we're going to give you a signing bonus, and then you start, and it's like, by the way, when was that signing bonus coming in? They're like, yeah, well, you got to be in the practice for 18 months.
Yeah.
Like, wait a minute, that's not a signing bonus. That's a stay-on bonus.
And another thing is paying a termination or liquidated damages clause from a prior practice. Like I have in my agreement that if I terminate within this period of time, the practice will seek for me to repay up to $10,000 for whatever expense, whether it's malpractice coverage or whatever else. Well, then my new employer, outside of the geographic scope of the non-compete, but will you pick this up? Will you pick up this cause in good faith to incentivize me to leave this practice and join your practice?
Was that tail insurance?
No, I don't. For this specific instance, it wasn't. It was just we prepaid your premium, right? And then your premium, if you terminate, you're gonna have to pay liquidated damages up to $10,000, let's say, or
Mhm.
whatever it is, because we prepaid your premium. But in reality, there are credits involved. You get you get pro rata payments, so you don't have to pay the full amount, or you'll get a portion back from the carrier, whichever doc leaves the practice, because they're not paying to cover that doctor anymore. So like it's a trade-off, right? So that's not the full amount of exposure. You're treating it like it's a liquidated damages, which means you did something wrong, you have to pay me the set amount. But in reality, what we would push back for is to get the actual amount. What did it actually cost you to lose us? Or were you at the end of the period where you're about to renew? Did you even pay any money towards malpractice for the year in which you're seeking, to punish our doctor for? If not, we're not going to deal with that. It's something we push back on.
Any questions that come to the top of your head that I haven't asked yet? Something that came up recently, maybe?
Well, I want to know how it's going, having moved from residency, right, to hitting the field now, and what that experience has been like for you.
Yeah, it's for the most part. I mean, private practice is much better than residency. I mean, that's hands down, hands down. I think the difference is I think a lot of residents don't realize is you could get the best training in the world, and then you go out and practice, and there's certain limiting factors where you may never actually get to do that. Some people, they do a fellowship in something. There's like head and neck fellowships. There's plastic, cosmetic fellowships. I see it a lot on the physician side where now they're working in a hospital where whether it's the rules, the regulation, the bureaucracy, the politics, they just did extra training in a fellowship, and maybe this extra thing, it's the nose, right? But they can't do it. I mean, the nose is a bad example. It might be the ear, it might be the throat. But they can't do it in their hospital setting because it's these surgeons do that in this hospital. And it's like, you can't do that, right? In oral surgery, I would say it's very different, right? It's not like, it's more apples to oranges, but the demographic that you may be treating like, you can offer this, but maybe very rarely, very, very rarely may you ever actually get to do that procedure that you've done 50 times in residency. But because of your spot in practice, it's different, right? Different demographics. Another thing I would say is I mean, private practice is great. It's really great. It's nice to have a structured schedule, which is nice. But yeah, other than that, I think it's interesting. I was always worried about having such a long commute, and now it's like mine's like 30 minutes. It's really not a big deal, but I think the biggest thing is just the time difference, where it's like I had a 5 to 10 minute walk commute to and from the hospital through the last 4 years, and now it's a 30-minute commute. So it's really not a bad commute in terms of everyone's jobs, but now that's an hour lost a day rather than 10 minutes lost a day. So there goes my workout right there. If I'm on a similar schedule, it's a different lifestyle, you know.
So if anything, you might be over prepared, having done procedures in residency that you would not have to do ordinarily in private practice.
Yeah, yeah. There were a ton of procedures that I never get to do in today's day and age. There's so much about being out in the real world and the responsibilities of it that is completely different from residency. I mean, it's on the other side of the fence. It's like it's obvious, right? But in residency, there's so many things that will happen that you just can't foresee. You can't predict.
Wow.
You know how it goes.
No, we had the opposite problem in law school. I mean, you have no exposure to any real issue, right? You don't know how to deal with the court. You don't know how to deal with the client. You don't know how to deal with basically anything that private practice requires. And you get thrown into the world, and you go from basically textbooks this thick, where you're reading decisions, judge issued decisions, very oddly written decisions to the style and everything, and then you end up writing that way in practice, and it doesn't make sense because it doesn't translate into real English, spoken English, or the like. And then you go from reading these decisions over a period of time to show whatever evolution of an issue, which is completely irrelevant in practice. You need to know what the issue is today, and the law is today. How it evolved or why it evolved is not relevant. In fact, if you argue old law, that might not be good. That might be frivolous. There's no real issue there. You need to argue the most current law or the most current case law on an issue. Early out when I graduated, the recession was in full force and effect. And I recall a number of students from different law schools in the city filed lawsuits against their law schools saying, you didn't prepare us for the world. And the judges quickly threw them out, but it was an interesting argument. You didn't prepare us for the world. You didn't make us employable. And therefore, in a bad economy, we couldn't get work.
The judge threw it out, though. What are your thoughts on that?
It's interesting. I wonder, because I think of these old school British style where you have like an apprenticeship and you work for someone for free for a year in that practice. I don't think for free is good. It's great for the practice that you work for, but not good for the individual struggling with the additional costs after, they paid however much for law school. But getting that hands-on experience is something I stress to all the law students I work with. Anyone that works the firm, paralegals interested in law schools, like go out, do that externship, do the mock trial in the moot court. That simulates what it's like to be in a courtroom. Get as much of that as possible, because that you'll be drawing on that more than you'll draw on a lot of other things.
Get practical experience in it. And you had that practical experience before you joined one of the bigger groups. I know this is one of the places that you jumped after that. You had your own practice, right? Own firm.
Yeah, I did for almost 9 years. And that was interesting because, you have a client, the client would need need help with a litigation matter, and that's great. And you do it for them, they're happy, and then they buy a home and they're like, hey, we want you to do the closing. And you become a jack of all trades, which is good. It's also challenging at first to sort of get up to speed. I was fortunate enough that my office was right next door to an attorney I worked with for many years, Theodore Mavromahalis, and he tutored me in these other areas, these real estate areas, transactional areas, and I was able to learn from him and get assistance from him to handle those matters. And then as it developed over the course of almost 9 years, became a jack of all trades in the profession.
But now you're kind of honing back in, or would you say you still do kind of a wide array?
I think about it plenty, but I don't actually do it as much here. At IX Legal, we have transactional attorneys who focus on corporate law, and transactional attorneys who focus only on real estate. We have a tax practice, a trust and estates practice. So as we get these issues in litigation, I'll walk over to those attorneys and sit with them, drag them in, and vice versa. They'll drag me in when they have a potential litigation issue brewing in a trust and estates matter. I had that conversation earlier with my partner, Stephen Bonfa. Having that resource and having these open doors here that we have. My door is closed right now because we're recording, but generally, and I want my fellow attorneys and paras and case managers and the like to feel free to come over, pull me out, or knock on the door and say, I have this issue, because I'd prefer for them to get it right, for them to actually think, use their noodle and not go to ChatGPT and it's like, well, how should I phrase this in a bill of particulars, or how should I respond to this issue, or how would litigation look? Ask me first. And if I don't know the answer, or I'm not familiar with the latest development, I can look up the case law, or we can see, did the law change in the past 4 years? We can have that discussion together. Our brains stay on. I think I read somewhere when you use ChatGPT, your brain turns off. And I don't want young attorneys doing that. They haven't experienced it the hard way that we have, having not, the luxury of using ChatGPT in law school or in early practice. And I want to see them use their brains to think, to problem solve, to go through and discuss the issues and be able to find how to resolve the problems on their own, but I'm not expecting them to do it on their own. Come back, grab me, and they do. I love that. I love that about this practice.
The creativity. Yeah, you got to keep the creativity going. You got to problem solve and think through that. I like that. The critical thinking before using ChatGPT or one of the other AI models. Yeah. Yeah. You mentioned other partners, other people, other areas of your firm. Are all the partners kind of different areas to create like a perfect collage, or is everyone only in one area?
No, we have a few areas that we cover. We cover a lot of ground, I think, in a real meaningful manner. And we don't tell our attorneys, our associates, you have to choose. Like you're either a transactional person or you're a litigation attorney. And if you don't choose, you're going to regret that. We have attorneys who want to try all the fields. And so we'll give them work in every field. And say you enjoy employment more, well, then you'll be working with me more on employment matters. Or you want to do more real estate. Like, there's plenty of work to go around. So we're happy to push people in the direction they want to go. And if they don't want to come up with a major, like a college major, and they want to just figure it out, then we're happy to use them as utility players. And it helps because we can throw numbers and bodies on a problem in different departments that might exceed capacities for mid-sized firms much larger than ours, or even small, large firms, where they have like little fiefdoms, where this partner has 5 attorneys, but they are loyal only to this partner, will only work for this partner. So this partner is not going to help the other partner with his problem, and this partner is going to help this other partner with her problem, provided she gets some sort of benefit from it. So we don't have those issues. Everyone works as a team. Everyone will be willing to answer the call when the fire bell rings. And overall, that's a good service we can provide for it.
Yeah, that's a great place to be at for mentorship and kind of crossing the paths over there. Would you mind just throwing up the symbol of your firm right there? It's on your right or left. Or that works too. I saw the paper on portfolio on the table. That's great. Yeah. So people can know. I want to make sure that we're throwing that up. Excellent. Yeah. Hey, this was a great chat. We got to touch on a lot of points here. This has been really beneficial to hopefully a lot of listeners. This would have been right at my alley. What, about a year and a half ago? Yeah. Obviously, I'm locked in right now at my current job, but yeah, man. Hey, thanks for coming on today and for kind of blocking out that time.
It's always a pleasure. It is. There's always stuff to do, and I think a few people knocked during the time and I encourage them to. So, I mean, that's just part of the culture here. And I really appreciate the opportunity to come on again and discuss these issues, any number of issues with you. And I do want you to come to the city so we can do it again in person.
I will. This was part 3. We'll have a part 4 next year. And you're in the office late, man. You got kids at home.
Yeah, I know. I do. It's fine. It's not that late. It's fine.
How many days a week you going in?
I have days in, so yeah.
How many days of the week are you in the office right now? And
3 or 4, depending on the week. But it also depends on what's happening. We have an arbitration coming up. We have to prepare for. So it's going to be 3 or 4 of us just sitting at our little war room desk over here, going through papers. We have our chart, trying to figure out what evidence goes where, and yeah, I'm looking forward to that too. So we'll see.
Good. A lot of excitement. And happy Easter, by the way. That was your last Sunday, right?
Thank you. Yeah, we were a week delayed. So
that's right.
Thanks. That was fun. Have you done a Greek Easter yet with the lamb and all the goodies?
Hopefully in the years to come. Things are kind of scattered right now with family and settling at home and a bunch of things on the plate. But yeah, thank you. All right, Konstantine. Thanks again. I hope everything goes well the rest of the night and you can get home at a decent hour. It's already getting late. So
thank you, Brent.
Thanks again. I'll see you soon.
You got it. Take care.
I'll talk to you later.
Bye.